Are we live streaming, David?
We are now live streaming, Pauline.
Thank you. We've just got a few seconds to go, Chair, and then you can start the meeting.
Okay.
Thank you, Chair. If you'd like to start the meeting now, it's 7 o'clock.
Thank you, Paulina. Good evening and welcome everybody to the Health Scrutiny Committee. I'd like to start by welcoming those members of the public and press who are watching via live stream through the Council's YouTube page. Due to government guidance on social distancing, this meeting is taking place remotely in accordance with current legislation, which makes provision for remote attendance and remote access to council meetings. The meeting is also following Peterborough City Council's virtual meeting protocol. In order for this meeting to run smoothly, I would ask members and participants to keep your video camera switched on with your microphone muted, except when you are invited to speak. If you wish to speak, then please raise your virtual blue hand, which is located at the bottom of the participants section. I and the Democratic Services team will keep an eye on the participants list to see who wishes to speak. Please be patient. If you are not invited to speak straight away, there may be other members who have had their hand up before. The Democratic Services team will be monitoring the participants list to see if anyone has dropped out of the meeting, and will try and contact you to provide assistance to rejoin the meeting. If we run into technical problems, I would ask for your patience. Should this occur, an adjournment of the meeting will be declared while the fault is addressed and the public broadcast will be paused. If it is not possible, the meeting will be adjourned until such a time as can be reconvened. Finally, I would remind members that all virtual meetings are recorded. I'll begin by taking a roll call of all Scrutiny Committee members to establish their presence. When your name is called out, please unmute your microphone and confirm that you are in attendance. Thank you. Councillor Ali.
Good evening, in attendance.
Thank you. Councillor Burbridge.
Present.
Councillor Hemraj.
Present.
Councillor Kyan.
Present, Chair. Thank you.
Councillor Rush.
Present.
Councillor Sanford.
Here.
Councillor Simons.
Yes, present.
Councillor Warren.
Here.
Parish Councillor Co-opted Member June Bull.
In attendance, Madam Chair.
Thank you. And Susan Mahmood, also in attendance representing Health Watch.
Here.
Also in attendance is Dr. Liz Roban, who will support the committee as lead officer, and Paulina Ford as supporting Democratic Service officer. Thank you. Now we'll move on to the first item on the agenda. Apologies for absence. Are there any apologies, Paulina?
Thank you, Chairman. We have apologies for absence from Councillor Barkham for this evening.
Thank you. Item 2, declarations of interest and whipping declarations. Do any members of the committee have any declarations of interest or whipping declarations?
I'm an employee for North West Anglia Foundation Trust. I will be taking part in the next agenda on the Green Travel Plan, but if there's any recommendations, I won't be taking part in any vote. Thank you.
Thank you. Okay, so on to agenda item number 3, minutes of the Health Scrutiny Committee meeting held on the 21st of September. We're being asked to approve the minutes as set out in the agenda as a correct record. Can I ask if any member who does not agree that the minutes are a true record of the meeting, click the virtual blue hand now. Okay, I see no hands raised. I'll take it that the minutes have been agreed by the committee. Agenda item 4, call-in of cabinet member and key officer decisions. Paulina, are there any call-ins?
Thank you, Chair. There are no call-ins for this evening's meeting.
Thank you. So on to our first report, agenda item number 5, update on North West Anglia NHS Foundation Trust's Green Travel Plan. I would like to welcome the following officers who are in attendance to present this report. Dr. Raj, Reggie, sorry if I pronounced your name wrong, Deputy Chief Executive Officer, North West Anglia NHS Foundation Trust, and Taff Giddy, Company Secretary, North West Anglia NHS Foundation Trust. God, what a mouthful. Welcome, and we're happy that you've joined our committee meeting, and would you like to present your report?
Thank you very much, Madam Chair. So we have submitted a paper which I hope you will have had the chance to review. So if I summarise our paper, so parking has long been recognised as being a problem at Peterborough City Hospital. It's caused difficulties for staff with frustration, getting to work at the changeover times, and as well as causing a lot of extra stress for patients for planned appointments, occasionally leading to them missing appointments. So as a trust, as the Legacy Trust of Peterborough and Stamford NHS Foundation Trust, we realised that this was a problem and pulled together a travel plan that would address access to parking spaces on the Peterborough City Hospital site. This was done in 2016, as you can see from the paper. But what we decided to do was to put this slightly on the back burner so that we could devote our attentions to the merger and the acquisition of Hinchinbrook Healthcare Trust to form North West Anglia NHS Foundation Trust. What we found after the merger was that obviously we had 3 hospital sites, but we also had 3 different approaches to car parking and access to car parking for both staff and patients. So what we wanted to do after the merger was to do a full stock take of all the access and harmonise our processes so that they were fair and equitable across the sites, not least because staff were starting to work cross-site. At that time, we were thinking about the main issue was allocation of car parking spaces, and considerations that were taken into account were, for example, those people who did unsocial hours, whether clinical staff should be given priority over non-clinical staff, and the distance that they lived from the site. This was coming to fruition in the beginning part of this year, in January 2020, after we had commissioned W.S. Atkins to prepare a travel plan for us. So we were getting to the point of making some decisions and implementing the plan back in January. Then, of course, the pandemic hit and our attention was diverted towards looking after the patients and managing the pandemic. Interesting things happened during the pandemic, in that we were forced to adopt different methodologies of agile working, such that fewer staff members were coming to site anyway. And secondly, we were adopting, according to the long-term plan initially, but much more rigorously during the pandemic, the policy of making as many appointments for patients virtual as possible. That's to say by telephone or by video conferencing. Latterly, what's happened during the pandemic is that we lifted all the car parking charges for ease of access. initially for staff and patients. Patient car parking charges were reinstituted in September, but staff car parking remains free, and we plan to keep it free until the end of March. This has led to more and more staff members parking on site because it's free, and has led to congestion once again. So what we are proposing to do now as our plan next steps are included in the paper. We are proposing to hire a project manager to actually enact the green travel plan now, to appoint a car parking management company to use automated number plate recognition to monitor and limit the number of people who can park on site. We will be resuming our discussions with Stagecoach about giving discounted travel to the site for staff members, and we will also formalise our agile working policy. We are committed to extending as much as we can car parking on the site, and through that to increase access to charging points for electric cars. So that's where we are at the moment.
Thank you. Thanks for that. Okay, Councillor Sanford with the first question.
Yes, okay. I've had an amount of experience of dealing with green travel plans, and the experience I've had in a number of other organisations is quite often, you know, there's a lot of effort goes into preparing them, but then they tend to get plonked on the shelf and not a lot happens. So just a couple of questions in relation to that. You say in the report that in paragraph 3.1 it says there was a green travel plan prepared for the Hospitals Trust in February 2016. Now, presumably that green travel plan contained, you know, targets and actions, but nowhere in the report does it say whether the targets in that green travel plan were actually achieved. So could you give us some information on that? So
the green travel plan that was prepared in 2016 never reached fruition. It remained as the plan, but it wasn't enacted, because what we would have had to do is have quite difficult conversations with people about whether they were actually allowed to park on site if they lived less than a certain distance from the hospital. So whilst we were discussing plans, it wasn't enacted at the time, and then our attention was diverted to the merger.
Okay, fine. Yes, so that explains that point then. I sort of had a look at the green travel plan that you're proposing, and in particular the section where it talks about targets, and you've got a number of targets about, you know, making increases in the proportion of people travelling to the site by public transport, increasing number travelling by bicycle, that sort of thing. So what mechanisms are you going to be putting in place to actually see whether or not those targets are achieved?
So what we need to do is to use nudge techniques to encourage people to use the buses, use bikes, do lease schemes as much as we can, and so on. The problem that we've got at the moment is we've got many more car parking permits than we have spaces, which leads to a lot of frustration on behalf of people who can't park readily, and they feel quite rightly that they've paid for their spaces. So in order to answer your question sort of backwards, we will tailor the number of permits according more appropriately to the number of spaces. So that's how we will do it, by not allocating or anyone who wants to have one a car parking space and taking money for it.
Okay, fine.
Okay, Councillor Ball.
Thank you, Madam Chair. I'd just like to ask a couple of questions. The first one is a more global question. and that's one of future-proofing. You say in paragraph 3.1 that you're looking at the current patient and visiting activity, but we all know that the capacity for patients at Peterborough City Hospital is nowhere near the combined bed space that we had at Peterborough District Hospital and the Edith Cavell Hospital. So why aren't we not just looking at current capacity, but also looking at future-proofing the Green Travel Plan and car parking management plan? And my second question is around the Appendix 1 in that same paragraph, 3.1, and it details your 2019 plan. And I was just wondering if you could tell us or talk us through how you've developed the extended hours of existing bus routes. Plus, I understand that there's been a bit of a commotion about set down at the main city hospital entrance. So you've extended the drop-down locations to a 5-minute walk away. How is this going? And bearing in mind that some of those bus travellers will actually be people with walking difficulties, is a 5-minute walk really viable?
Okay, so if I can address the future-proofing. So the way that we will approach this is actually the doctor-patient or the organisation-patient relationship has changed over the years. So previously we were doing hardly any appointments by telephone. We certainly weren't doing any by video conferencing. So at least a third of our appointments are virtual now. So that means fewer patients coming. So so that's one thing. Equally with the staff car parking, because we now have remote access and people can work from home, people can actually do video conferencing appointments. Clinicians can see their patients remotely from home as well. And our job planning policy is going to allow every consultant 1 day at home. So it will reduce the aggregate mass of people wanting to park there. So that's what I would say would be the future-proofing strategy as regards the actual spaces. As regards the bus setting down points, it sets down just at the entrance to the site, just at peak hours, just during the rush hours. The rest of the time, the buses drop right at the front of the hospital.
How's that working with people with physical impairments, though?
So what they can do is request. They can request appointments not at 9 o'clock in the morning or not at 5 o'clock in the afternoon. It's just during the rush hour that they set down at the opening to the site. And I agree, it's a good 5 minutes walk for someone with difficulty walking.
I'm grateful, thank you.
Councillor Bearbridge.
Thank you, Chair. Just a couple of points from me. The first one I have raised at previous meetings. You say you're in talks with Stagecoach as part of your green travel plan. Consideration towards an arterial bus route that encompasses all the parkways of Peterborough, picking up at all the various townships in Peterborough and setting back down again at Bretton and at the PCH site. I was just wondering whether you've given consideration to that. And the second point is I have concerns about the use of a car parking management company and the ANPR cameras. We all know how these companies can sometimes operate, and when people are coming into hospital and they're obviously under great amounts of stress, illness, the last thing that we really want to be doing is heightening those stress levels by them receiving a red letter demand for £100 a couple of weeks later in the post. So I think that needs reconsideration. Thank you.
So in answer to your first question, yes, we're going to resume our discussions with Stagecoach. So we can certainly, nothing's off the table as regards the discussion. So those are good suggestions that we'll take on board. And secondly, the ANPR is largely for the staff car parking. It's for people who have permits already, or we need to check that those are recognised number plates. The patients will continue to pay in the machine, take the ticket and pay in the machines on exit.
Okay, so as a councillor in one of the wards adjacent to PCH, discouraging staff from parking on site where they're working does actually spill over into the streets surrounding PCH, and that does create a lot of problems sometimes, with people parking in local residential streets and residents coming in and out of work not being able to move the cars off the driveways, and it's got quite confrontational sometimes. So I think that needs to be addressed there too.
Yes, I would agree with you.
So have you actually got any ideas as to how you can prevent that in future?
So we will appoint the project manager and look at all these threads, because we want to encourage people to adopt the other mechanisms of getting to work, namely the bus, the bike, and so on. So we will be linking in with the local authority about the possibility of an additional entrance and exit from the site, and at the same time we can address the issues of residents parking as well.
Okay, thank you. Councillor Simons.
Yeah, thank you, Chair. Yeah, you talk about you're going to allocate less permits. Is that not going to compound the problem with the staff parking in the local streets? That's one of my questions. And the other question is, will you still be considering the park and ride scheme?
So allocating fewer permits will encourage people to, as I say, we'll be trying to use mainly a nudge technique to other ways of getting to work. The problem that we've got at the moment is that everyone who applies for a permit is given a permit, and there simply aren't enough spaces anyway. So it's a sort of lose-lose situation, because people are paying money and then they're getting frustrated because they can't park. So what we need to do is address the whole thing properly, which is what the Green Travel Plan, the project manager, will endeavour to do. And yes, the park and ride scheme can certainly be entertained. Sorry, I forgot the second question.
That's all right, that's fine. Councillor Kayam.
Thank you, Chair, and thank you, Dr. Ege, for that insightful piece as well. And first of all, I'd really like to thank you for all that you and the staff have done over the duration of lockdown. You really have worked very hard, and we're all very, very proud of you. So thank you very much on behalf of all of us. I'd like to ask you, you did raise a point about patients having accessibility in terms of being given a choice of appointments other than the peak times. Within my experience of working in primary care, I've often seen that a lot of patient appointments are now becoming cancelled, and I'm sure that that's because that you're trying to prioritise those urgent patients, especially for cancer care, etc. So my question aligns with Councillor Ball's question regarding accessibility of the elderly, the frail, the physically impaired. But do you think that through cancellation of quite a few appointments, that would reduce that availability? And is there a way around it, please? Thank you.
So what we need to do is be very mindful of the accessibility agenda, particularly now looking at everything through our health inequalities agenda, which is one of the things that's really emerged strongly from the pandemic. I think if there are accessibility problems, the first thing we would do would be to try a telephone appointment to see whether that sufficed. If not, make an arrangement with the patient to either come in at a time that was available, or to try some other way of addressing the patient's needs.
Okay, thank you. Just a follow-up question. Is there any chance, in order to improve communication, that would decrease that footfall and make those consultations, as it were, more effective? Is there any remit or any possibility that one could look into accessibility of, say, or provision of a more robust appointments sort of system? Because a lot of complaints are coming back about not being able to reach the hospital in the first place through the switchboard, about rearranging appointments or arranging them, etc. So I think that would be a good option in order to sort of streamline and make sure that things are working smoothly with the proposals that you've suggested.
Yes, so I will agree we need to improve our accessibility so that people feel confident in changing their own appointments. The other thing that we're also looking at is something called patient-initiated follow-up, because what we have at the moment is a lot of planned follow-up appointments after procedures or while to make sure people are settled on their treatment regimes or what have you. And it's not obvious from the outset that all of those appointments are strictly necessary. So we're trying to move to a system whereby the patient themselves can decide whether they need to be reviewed and how they need to be reviewed, whether the telephone will suffice. And again, hopefully that will diminish the numbers in the cohort that need to come to the hospital.
Thank you very much, and thank you for your time.
Thank you.
Councillor Sanford.
Yeah, having asked some general questions, I've got a couple of specific ideas I'd just like to put to you, really. The first one is on car sharing, which is in paragraph 6.5 of the Green Travel Plan. The organisation I work for, which is a conservation charity based in Grantham, as part of its green travel commitment, has a car park that's only about half the size that's needed for the number of employees. And what they've actually done in order to encourage car sharing is to actually charge people that don't car share as a means of encouraging other people to car share. So I think some form of differential charging to encourage car sharing amongst employees, I think, is something that's worth looking at. And on the issue of public transport, I'd just like to support the point that Councillor Chris Burbage made. This idea of encouraging circular bus routes, because I suspect one of the reasons a lot of people don't travel to the hospital by public transport at the moment is from a number of parts of Peterborough involved, going into Peterborough and then travelling out. And my suggestion on this point is that as well as talking direct to Stagecoach, the Transport Authority now in Peterborough is the Cambridgeshire and Peterborough Combined Authority. And I actually know from another committee that I'm on that they are exploring the possibility of introducing circular bus routes. So I think having a conversation with them as part of your green travel plan could be helpful.
Yes, thank you for both of those suggestions. Car sharing at the moment is obviously not advisable during the pandemic, but yes, I do take your point.
Councillor Hemraj.
Good evening, Dr. Reggie. My question is, you mentioned about ANPR for staff, but what's the guarantees that if this is successful with staff car parking, how do we know that this won't be rolled out towards visitors and patients, and then if they've overstayed their welcome, they've ended up with a nasty parking ticket through the door 2 weeks later?
So what we will do is introduce a system whereby payment is made at the end, because I think we all understand that the stay actually in hospital, the time in within the building, is notoriously unpredictable. So, you might be sent for an X-ray, or you might have to wait at pharmacy. So we will put something in whereby you don't just pay for an hour or what have you, you pay on exit.
Okay. Councillor Bull.
Thank you again, Madam Chair. Just a quick question. You can incentivise staff to car share, to walk, to bike, to use public transport, etc., through rewarding good practice. But what about the mechanisms to incentivise the public? It can't just be about discounted bus fares.
So I'm not exactly sure what you're proposing there.
I'm asking how you can incentivise the public to get out of their car, to walk, to bike, to use public transport, it's that you have a mechanism to allow staff to do that. You have a reward system, a rewarding good practice. You only have one mechanism from reading the report that I've read, and that's discounted bus fares. Is there anything else you can do to look at how we can change the public's behaviour by becoming more aware of carbon emissions and things like that, but getting out of their cars?
Okay, so for the vast majority of our patients, either walking to the site or biking to the site is not going to be relevant. So it's things about, well, as I say, it's maximising the use of the virtual platforms, so video conferencing, telephones, and so on. We also have community hospitals as well, peripherally, to try and give patients their appointments as close as possible to where they live. That's another way that we could minimise the carbon emissions. But I'm not sure how. I think that would have to be generally part of public health or a wider initiative than just the hospital to incentivise the public to change their habits.
I agree that it would have to be a wider mechanism in place, but it does need to be looked at globally rather than just the devil in the detail. The strategy, the overarching strategy has to be there. I concur entirely. I'm grateful. Thank you.
Okay, next question from Suzanne Mahmood.
Thank you, Chair. One of the questions that always comes to Health Watch is what happens if I don't have very good IT skills, if I really can't understand how to do video conferencing. I really do want to see somebody in person. I appreciate the logic of freeing up your car park by having fewer people actually come, but I know that we will be getting queries about what do I do because I'm elderly, I'm frail, I don't see very well, I don't hear very well. I really have got to come to the hospital.
So those people won't be allocated video appointments. So the first thing will be telephone, and if necessary, come to the hospital site and make appropriate transport arrangements. So no one will be forced to undergo healthcare in a way that they don't feel comfortable with.
I think the problem is it's not always terribly well communicated, and logic when you're elderly and you're ill and you can't walk very well goes out the window in my experience. So as long as it's very well communicated, I don't think there's a problem. But if it's not, I can see there are going to be a lot of elderly sick patients who are going to feel they're not wanted anymore.
Okay, what I would say, it looks like all the questions, everybody's asked everything that they want. There are a few things that I would like to cover. So firstly, with regards to a project manager, I'm anticipating, or I'm hoping that you have a deadline for when you hope to have a travel plan in place. As you can tell, our committee are quite passionate about what's going to happen at the hospital. So is there a time element to this work?
So we're hoping to certainly commence the work as soon as possible within this financial year, bearing in mind, of course, we are now diverting our efforts very much towards the second wave, which is real. And I'm sure Dr. Robin will comment on that further. But yes, as soon as possible, because as I say, we've hit this unforeseen problem that because the car parking is currently free, actually we've got more staff car parking at the moment. So we do need to address it as soon as we can.
Yeah, I guess, I mean, yes, we're going through a pandemic at the moment, and obviously everything has been put in place with regards to technology and making phone calls and video calls to patients. What guarantee can you give me that you're actually going to continue working in that way if we do get the pandemic under control, if we get the virus under control, that we won't resort back to the old ways of patients having to go to the hospital? Because obviously that's going to have an impact on the travel plan. So, you know, you might put a travel plan together as the situation is now, but if it reverts back to how it used to be, then obviously your travel plan isn't going to be worth the paper it's written on.
Yeah, I think it's very unlikely we'll go back to seeing everyone face to face, simply because we had implemented the virtual appointments even before the pandemic hit this country. As part of the long-term plan, the NHS long-term plan, we were asked to reduce our follow-up appointments by 30%, which actually we were able to achieve as a trust. The long-term plan also estimates that 6% of all pollution is caused by people going to hospital for outpatient appointments. So it's a sort of moral imperative apart from anything else. On a more selfish level, it's a win-win situation for not only the patients, but the staff as well, to do as much as possible remotely, because the clinicians themselves don't have to be on site to see patients face to face, which is easier for them and cuts down their carbon footprint as well.
That's good to hear. That's the sort of response that I wanted, and I'm sure you'll make every effort to make sure that things sort of continue the way they are now. So we don't have any more questions. I'd like to thank you for coming, and you as well, Taff. Yeah. You didn't say a lot tonight, but is there anything you wanted to raise at all?
Thank you, Chair. I think Dr. Rege has covered everything that's in our plan. I think the one thing that I know Caroline has highlighted before and will highlight again is that, yes, the Green Travel Plan is owned by the Trust, but there are a number of elements that are dependent on the Council and other partners helping us, and we would not be able to deliver those. And we talked a little bit around the bus service and things like some of what the councillors were talking about around the park and ride are not within the control of the Trust. And actually we would welcome your support and engagement in that process to help us achieve those things.
Certainly, we will do whatever is necessary to help you, and by all means get in touch with me as chair if you need any assistance with regards to any of the issues that we've raised tonight. But thank you very much for attending, and you're welcome to leave and have the rest of the evening to yourself. But thank you very much.
Thank you, everyone.
Cheers.
So with regards to the recommendation for this particular report, it is recommended that the Health Scrutiny Committee notes the progress made to date by North West Anglia NHS Foundation Trust in moving forward its Green Travel Plan and its future plans within the context of responding to the global pandemic. Do I take it that everybody, are there any objections at all that we agree to note the progress? No? Okay, then we consider that the report has been agreed by our committee, and hopefully we will follow on with that at a later stage. Just bear with me a second. So if we now go to the next item on the agenda and welcome Dr. Robin. So it's Managing COVID-19 Public Health Update. And over to you, Liz.
Thank you, Councillor. And clearly this report was written in time for submission for publication. So as always, these reports are a little bit out of date on the latest epidemiology because they need to be published in advance. And I'd like to start by just updating you on the latest information on the rates of COVID-19 cases in Peterborough. and what is happening most recently. So in the report, you'll see that the paper describes about 80 cases per 100,000 for the week ending the 5th of October. That's what you see on the graph in the report. And since then, these numbers of cases have increased, just as they have nationally. So for the week ending the 28th of October, our rate is 139 cases per 100,000. That is about, and that is for a week, and that is about 282 cases in Peterborough in that week, ending the 28th of October. So we're not at all out of line with the national picture. And if anything, our rising cases is slightly slower than the national average, but our cases are still rising significantly. And that's very important to understand. So just to give you a bit more context, and we always compare ourselves with other areas by looking at our weekly cases per 100,000, that figure of 139. The regional average for the east of England is 102 cases per 100,000, but the England average is 228 cases per 100,000. So Peterborough is in between those two. Sadly, we have recorded one death in the week leading up to the 23rd of October, and that's recording up to the 31st of October. It is important also to say that even since the report was written, what we call the epidemiology has moved on. And it's now clear that cases are distributed across Peterborough. They're not just confined to one area of Peterborough, and we are seeing cases in both the rural and the urban areas of Peterborough Local Authority, the area the council covers. And also those cases are affecting all communities. The largest community in Peterborough is the white British, so the largest number of cases is amongst the white British, but the cases are spread right across all communities that we have in Peterborough, and is also spread across age groups. The highest rates are in the younger population, but we are seeing some cases among the older population as well. Older, middle-aged and older. And that does lead to more pressure on our hospitals, as Dr. Regje has mentioned. This is a key issue for the NHS at this point. So that is an update for you on the figures that you see in the paper itself. And while our cases are going up, and we mustn't be complacent about this, and we must take strong action, as indeed is happening at the moment nationally, I would still say that Peterborough residents and Peterborough services have done very well over the recent months through the very strong efforts made to contain COVID-19. So we have moved from a position in July where we were at one point in the top 10 nationally for rates of cases. And although our case rates are going up, we are now well below the national average. So the work that's gone in has not been wasted, and Peterborough would be in a very different position if that work by our local residents, our community leaders and our services had not been taking place since July. And I'd just like to thank everyone again for all that people have done. And this paper, as you know, describes a range of work that's going on to prevent and manage COVID-19. So it touches on strong communications campaigns, which are targeted where needed. Some fantastic work by our community leaders, which was highlighted at a summit in early October. And you have the YouTube link in the paper. I would particularly like to mention our environmental health officers and all of the very varied work that they've been doing around enforcement, around advice and around contact tracing, and that's been quite well publicised. They're getting good results. I would note the new local testing centre at the or close to the Gladstone Park Community Centre, which has reinstated good access to testing for our local population after there were issues in September, definitely, with access to testing. And also I would like to refer to the very good work between our community safety team and our constabulary on increasing that enforcement presence in various areas of Peterborough and ensuring that that is effective. So I'll finish by saying that we absolutely need to continue our hard work in Peterborough to keep cases down. We have got the national lockdown being discussed in Parliament tomorrow. And that really reinforces the basic scientific evidence that COVID-19 is transmitted by social contact between people. And clearly when you get a short-term lockdown such as the one that's now being proposed, the main impact of that is to reduce that social contact between people. But that does need people to comply with the national rules and guidance. And it just means that those behaviours which I reiterate so often, of maintaining a social distance of 2 meters between people, frequent hand washing and good hygiene, because the virus can also transmit through touching the eyes, nose and mouth with the hands, and wearing face coverings where required. All of that remains very, very important when people are out, which they may need to be to go to work, to school and so on. And this is going to be the case for some time, so we need those behaviours to become embedded. And the other point to make really strongly is the importance for people to properly self-isolate when they have COVID-19 symptoms. Get a test, either by going to a test centre or by ordering it over the phone or internet. And people really need to self-isolate if they've been in close contact with a case and they're asked to isolate by the Test and Trace Service or by Public Health. And I would add to that sort of little list of key behaviours, getting a flu vaccine. Because that will help to reduce pressure on the health service. If you're eligible for a flu vaccine, do please get that. So the basic messages don't change. The basic need to do that ongoing hard work that we've been doing in Peterborough, and Peterborough's good at hard work, and it's really had an impact. That continues, and I would just use every opportunity to continue to emphasise that. And I'll now stop for questions. Thank you, Chair.
Thank you, Liz. Councillor Sanford.
Thank you. Yes, in continuing the theme of thanking people, I'd like to record my thanks, and I'm sure the committee would as well, for all the hard work that the public health team has put in. You know, because you've been keeping councillors informed through emails, and you've been giving us really good briefings at the group leaders meetings also. And I think we've got something coming up a bit later on the agenda where the committee has actually written to our MPs calling for an increase in the public health grant that's given to local authorities. And I think if nothing else comes out of the pandemic, I think it shows the need for government to properly fund public health. But I've got a couple of questions. The first one is on the paragraph 4.2 about the graph, and you've actually mentioned the number of cases in Peterborough. One of the things I've been finding a bit confusing, and I'm sure other people have found it confusing as well, is there's a number of different statistics are being quoted. There's number of cases that are recorded from tests, but we know that's an underestimate of the total. And then there's cases recorded by the Office for National Statistics, which is based on surveys. So these ones that you're quoting for Peterborough, are they coming from the tests, or are they coming from the surveys?
The ones that I'm quoting in Peterborough are coming from the tests. So you're quite right, they are an underestimate, because not everybody gets symptoms, so not everyone who has COVID-19, and indeed may be infectious with COVID-19, is going to be have that recorded through a test. So the ONS survey tests people at random, so it just takes a sample of the population and tests everyone on a regular basis. And that survey is at the moment showing that about 1.1% of people, so that's about 1 in 100 people, is test positive for COVID-19 in the most recent period. So that is a significant increase on some of the figures that we were seeing back in the summer. And we're not identifying all of those through the testing programme. So absolutely correct, Councillor Sandford. In the east of England, that rate is a bit lower. It's about 0.5%, or about 1 in 200 people are testing positive in that population sample.
Yeah, okay, thank you for that. Just one question also. At the end of your remarks, you mentioned encouraging people to go and get vaccination for flu, and there's been quite a big media campaign on that. But I've actually been to about 3 or 4 different local pharmacies and inquired about having an injection for flu, and every single one has told me, oh well, we've actually run short, and come back in a fortnight or come back in 3 weeks or so. So can you enlighten us to what the cause of that problem is?
I can see Jan Thomas on the call, and she may need to help me with this. I would just say that there is a really major issue which is why we absolutely cannot be complacent in any way with the impact of COVID-19 on our NHS. And all the many calls on the NHS in winter, including catching up with some of the work that planned work that couldn't be done during the earlier period of lockdown. There's really 2 reasons to get the flu vaccine. Firstly, we don't want people to have the COVID-19 infection and flu at the same time, because that can make their personal situation worse and more risky. But also, people are really contributing by having the flu vaccine, because they're less likely to become seriously ill and go into hospital with a flu-related illness. And I think because of that, and Jan, I'm sure will come in and help, there's been there's a real drive to get people vaccinated, but also a real prioritisation to make sure that the people who are most at risk of being seriously ill and going into hospital are vaccinated first. So I think what's happening is that vaccine is being really prioritised and used very quickly. But Jan, Chair, if I could hand over to Jan, because
sure, no problem.
Very involved.
Good evening. So the flu vaccination, this programme this year is the biggest flu vaccination programme that we've ever tried to do. Because of what Liz said, we really are trying to be able to protect health services to make sure that we can carry on doing all of the care people need. That's the routine work, as well as the cancer work, as well as any urgent care. So the vaccine, though, is there is plenty of vaccine in the country, and what we're having to do is tranches of it and apply. So the pharmacists can apply for additional vaccine, as can the GPs. And the programme is very comprehensive, because you might remember they said you could always also vaccinate over 50s. So we're having to do a lot of work to make sure people have got the vaccine stock through these vaccine programmes. But I can't emphasise what Liz is saying enough. We do know there might be a problem sometimes in getting the flu jab, but it's really, really important. And anything we can do to protect against, to keep those health services safe, whether it be really sticking rigidly to the lockdown guidance, or doing the flu vaccine, or in the days ahead, months ahead, when a COVID vaccine hopefully should be available, we would be asking everyone to do it to protect the routine services, as well as the urgent services, as well as the emergency ones.
Okay, Jan, thanks for that. So if we continue going to a pharmacy or to the GP surgery and they say they haven't got the vaccine, what would you recommend we do?
I'll hand to Jan again, I think, on this one, if that's okay.
I'm very sorry, I had an emergency text come through, which is why I looked down, so I didn't hear the question.
No, that's
sorry, could you just repeat that?
Yeah, I basically was saying if we go to a pharmacy or to a GP surgery and they're saying they've run out and they continue to give us that information, what would you advise?
Let us know. So let myself know, or somebody in the CCG know, so that we can pick up with that pharmacy, because we want people to get it. So I would say also, if people can't get it from their pharmacy, then go and work with their GP practice, because the GP practices are getting transfer vaccines and they get access to the cool down vaccine. So, you know, it will be available if you're eligible through your GP as well at an appropriate time. So if you can't get it through the pharmacist, either come to the CCG or work with the GP practice.
Yeah, can I just come back on that point, because it's you're saying inform us which ones it is. You know, I've been to Boots, which is the largest pharmacy. I've been to Sainsbury's. I've been to Wow, and you know, so every single pharmacy that I've approached says that they've actually run short. So that sort of indicates there's a problem somewhere.
Is that in Peterborough?
Yes.
Okay, so let me take that away. Let me take that away, and I'll get people to come back. We are doing everything we can to encourage people, and we do have surges of availability, and then they run out, and then we have to surge again. It's nothing we control locally. It's what we have to. It's how they release it nationally. But we can certainly feedback if there's a big area of Peterborough where nobody can get one in a pharmacy. That isn't something I've heard before, so I'll take that away.
Lovely. Thanks for that, Jan. Councillor Hemraj.
By now, I would have hoped that most vulnerable people have had their flu jabs. And I do know that there was a delay in starting the flu jabs because of the availability of it. And I know that the hospital had problems because of availability, and they've now restarted their staff vaccinations. Myself, I had mine done at work. The issue is that now we're heading for a lockdown from tomorrow night, and we haven't managed to vaccinate all of those vulnerable people. How are primary care going to do this? Because I know that one of the GP surgeries in the ward that I represent is actually closed, and they're being asked to go to the Nightingale surgery. And speaking to residents today, that a lot of residents in a certain area is now not going to that surgery and then joining a different surgery. I'm just concerned that we're not going to reach those vulnerable people that because of the lockdown. And if that's the case, would it be a recommendation if those vulnerable patients that haven't had the flu jab are hospital inpatients or care home patients actually have their flu jab while they're in the hospital? I know it's a bit of a wordy question.
Again, I think Jan will be able to speak on the detail of that, Councillor Hemraj. I would say just that during lockdown, it's been really emphasised in the national guidance and messaging that people should still be using health services. So they should still feel that it's absolutely the right thing to do to say go to their GP surgery to get a flu vaccine and do the other things that are needed to access key health services, and that's I think an important message to get out. Clearly that's done in various ways, and there may be more remote consultations and so on, but it's very important if people need NHS treatment they continue to go to the NHS in the right way. So I'll hand over to Jan now for a bit more detail on that recommendation.
So to be honest, I was going to say exactly that same thing. The lockdown rules this time and the guidance was, there was one specific difference that jumped out at me, and it was exactly that point that said actually, if you need healthcare, whether it be routine or emergency, you must go and seek healthcare. Because one of the things we're finding now, and unsurprisingly, I think, is that people are sicker when they go into things like A&E. So we need people to access healthcare services early. We need to keep on with the immunisation programme, things like the children's immunisation programmes. None of that will stop, nor will the flu vaccination programmes. How they do it might have to is adapting, but that message is different from last time. The lockdown actually says if you need healthcare, please go and get healthcare. And I think the flu vaccine, that same thing applies.
I just come back on that. I just know that a lot residents that I'm speaking to and you hear it about, I know that there's been a lot of people that, regardless suffering with mental health or whatever, since the first lockdown, has like refused to go out of the house. So if we can't get them out to the house to visit food shopping or whatever, how can we get them to have the flu vaccine? Because we do know that, I know personally that there is people that are absolutely scared, that have not taken step 1 foot since outside since the 22nd of March when we first locked down, and now they're not even attempting to go out since.
I think that's a really good question, Councillor Hemraj, and I think we can take that observation perhaps back into some of our flu vaccination planning forums. I can raise it at the Health Protection Board, and I'm sure that Fiona Head would be discussing it at some of her forums. So I think it's a really good question, Councillor Hemraj. I think we can take that away and make sure that that point is sort of fully raised, that there's this awareness of vulnerability, and how do we work on that. So quite happy to take that back to the Health Protection Board.
And I think it does raise a wider point around what Liz was talking about, which is why access to healthcare services is so important. We're not just talking about physical health services. You know, we understand the impact that this is having. We've seen demand rise for our mental health services, and so on. So, you know, those vulnerable patients, we need to take extra special care of, and make sure that we're not just thinking about their COPD, their diabetes, but actually that social isolation and the psychological impact of that is material, and we're very aware of that.
Thank you. Just coming back on that for both of you, Liz and Jan, just I mean, obviously there's all sorts of leaflets and posters and campaigns out there, but I am aware that, you know, people of a certain age, our senior citizens, like the ones that Councillor Hemraj mentions, they generally like to obviously watch the news, etc. I think we might have lost, have we lost Jan?
I think we might have done.
No, I'm here.
Yeah.
Oh,
Okay.
there.
Was I just very still?
Oh, there you are.
I was turning my heating down. I was getting hot.
That's all right, that's fine. I'm just conscious that, I'd like to say, a lot of our senior citizens watch the news and their local news, and I'm just wondering whether any type of information that we really need to get out to the public, we could actually tag on either at the beginning or the end of a news report for say ITV or something like that, if there are certain messages, especially to do with the flu vaccine, to make them aware, and for anything else. I just wondered whether you'd sort of considered that at all.
Yeah, so we've obviously been linking up a lot on the comms. I think Liz is becoming something of a whiz at the BBC interviews and the ITV interviews lately. I do think we'll take that back to our Warm and Informed group, back through the Health Protection Board, just to make sure that we've linked up those both things. I know there's lots going on, but you're right. I'm not sure we've explicitly said, and in COVID, please make sure you get your flu jab. So we can take that back. It's a really good idea.
Lovely, thank you.
Yeah.
So on to the next question, Councillor Ball.
Thank you, Kim. If I could ask Liz, just to confirm my understanding of the statistics that you gave earlier. The trend in Peterborough is that the figures are doubling every 4 weeks, and we have a higher weekly incident rate than the east of England. Is that your take on where we are currently?
Yes, that's approximately right. Yes, we're going up by about 20 cases a week, so it's not exponential, but we are seeing that rise, a steady rise, which when you look at the graph, it is sort of that nature with some variation around the place. And yes, we are higher than the East of England regional average.
Yeah. I took those statistics. Week commencing the 28th of September, we had 126. And then we had the following week 165, then 193, and then week commencing the 19th of October 262. So basically that is definitely a more than doubling in 4 weeks. So that there is a concern there for
Absolutely.
And my second question, if I may, is around paragraph 4.5 in the report. I'm conscious that we've had a government grant of just over £1 million, some of which obviously has been shared with Cambridgeshire for test and trace. Can I just ask, is this sum also assisting Pillar 2 test and trace, and how is that actually working? Thank you.
Okay, so yes, we have received that grant in Peterborough. Cambridge has also received a grant, and we're getting, in a sense, best value by having a lot of services which cover both authorities, which makes the money go further. So that's the way that, and we monitor that quite carefully and are spending it on a range of things. The Pillar 2 testing is commissioned by the Department for Health and Social Care, so that is all funded nationally, and that is the majority of testing. So the Peterborough drive-through, the mobile testing units that you see, and the local testing centre at Gladstone Community Centre are all funded nationally through DHSC. And those all offer Pillar 2.
Okay, I'm grateful for that answer. As a result of that answer, I have a second question, if I may, Madam Chair, and that is it the national that's results that are slowing us down? Are we on par, or are we locally not on par with the national results for test and trace?
Okay, so it is a national system. So in terms of results, so you're thinking about the accessibility of testing and the testing turnaround times?
Precisely.
Yeah. So yes, the turnaround times, because the tests are run in national laboratories, the turnaround time should be reasonably similar across the country, because they are run in these really large laboratories. There are some differences between turnaround times at the drive-through centres, at the local testing centres, if you get a postal test, which you order over the internet or by phone, or that some of the other programmes like the care home testing programmes. So the postal method and the care homes testing have been taking a bit longer than some of the test results from the drive-throughs. But basically that will be in line with the national picture. Where you can get more variation is firstly in the accessibility of testing. So the tests are kind of nationally determined, and when we had there was a point in September when we had very high rates and rapidly rising rates of cases up in the north of England, and we the testing capacity needed to test everyone was not sufficient to meet demand. That was also just after the schools reopened. Lots of children and families got colds and viral illnesses. So there was also a real peak in demand for those children, particularly primary school age, actually, most of whom didn't have COVID, but there was lots of demand for tests from those children and their families. So there was a real pressure on the testing system. And when that happens, nationally, they will prioritise the tests in the areas with the worst outbreaks. So what we found in the east of England was that we had fewer tests allocated to us. And that meant that, you know, you might have the drive-through centre with the staff there sort of standing empty with no one going there because only a certain number of appointments were allocated. So we did have problems with issues with access to testing back in September, and they also stopped all the walk-ins at the mobile testing units, which for me was a pity for Peterborough, because I think a lot of people have been accessing Gladstone Park on a walk-in basis. That's why we got the local testing centre, where that it's mainly through appointment, but there is that access for local people through walk-in again. So I would say it's definitely improved since that issue that we had in September, and both our access locally and the turnaround times have shown some improvement, but still that needs to improve further to get the best results.
I'm very grateful for that very comprehensive answer. Thank you very much, Dr. Robin.
Right, okay, so at the moment, I'm just conscious of time, and we have Councillor Ali, Councillor Hemraj and Councillor Sanford, and then I think we'll stop the questions questions from there. So, Councillor Ali.
Thank you very much, Chair. A couple of observations and a couple of questions from me. First of all, I'm very grateful that I know I raised a couple of issues for the Millfield area about social distancing, and I'm very grateful the way that the agencies have come together and actually made a concerted effort, and some of those challenges were addressed basically. But obviously we need to sustain that because of the growing number of cases that we are getting. We need to make sure that we are on top of things. We cannot get complacent in terms of letting the situation get any worse. I mean, two people have asked about the flu jab. We clearly know that number of vulnerable people who read letters, etc., to go and get their flu jab, and that's become extremely more important now, particularly the vulnerable people within our community, to get the flu jab. Do we have any figures in terms of the uptake of flu jabs this year because of the necessity of the COVID crisis as well?
I don't have those figures at the moment. I think it's still quite early days. Jan may be aware if anything is coming through the NHS routes in terms of flu jab uptake, but I think we're slightly early days at the moment for that to have been collated.
Okay, thank you, Chair. If I can carry on. In terms of, tomorrow we're going to go into another lockdown, and I know in the past, Liz, our community, they responded excellently, particularly the faith communities, community organizations, and I know our local mosques have done a fantastic job in terms of the way that they've looked after the facilities when the mosques were reopened, and the members of the congregations have been very observant, keeping the distance and clearing the way very quickly after their prayers as well. But with what's going to happen tomorrow evening, there's still a lot of ambiguity about how, particularly with regards to the mosque, basically, because people come to the mosque for congregational prayers, and how that will be impacted. No doubt you will be talking to our mosque representatives as well, but I've had a couple of concerns already raised that people have been behaving really well in our mosques as well, and they don't want to be punished basically and prevented from offering their congregational prayers, because unlike other faith institutions.
Councillor Ali, sorry, have you got a question?
Yeah, sorry, Chair. Yeah, I just want to, what advice are you going to be giving to the mosques, how they actually address the challenges in terms of keeping the mosque open for worshippers?
I think the first thing I'd like to say, Councillor Ali, is to absolutely endorse what you say in terms of the very good COVID safety that we've seen at our mosques, and also the role of the mosques in giving out messages to their congregations. The mosques in Peterborough have been absolutely fantastic, and I would like to repeat that and endorse it. We are moving into a situation where there are national regulations, and my understanding of the national regulations on the places of worship is that the regulations that are being put forward are likely to say that there would be no congregational prayers for any of the faith communities, and that places of worship would only be open for individual worshippers. That's my understanding of the regulations that are coming forward. I can absolutely appreciate that this may be very frustrating for places of worship that have done such a good job in maintaining COVID safety. But ultimately, when we move into a situation of national regulation, then our local flexibilities are not there in the way they are when we have a greater element of local control, which we have had recently, but we are moving back into a 4-week period of national regulation. That is the only advice I can give, really. That is the situation, I'm afraid.
Thank you very much. Thank you, Chair.
Okay, Councillor Hemraj.
It's just going back to the flu jabs again. I noticed that the children have a spray and adults have the injection, but I don't know if it's possible, but if we've got those vulnerable adults that are refusing to leave their house. Is there a possibility that the flu spray is actually sent to that patient and then they're able to do that themselves? I don't know whether that's a possibility. I'm not quite sure, but it's worth a suggestion.
Yes, thank you for the question, Councillor Hemraj. I don't know the answer, I'll be quite honest. That's something I would want to go away and consult with others on. It does seem perhaps a little unlikely, because if a solution that was relatively straightforward was available, I would think that maybe that would have been already put in place. But I'm happy to provide a written answer to the committee on that, because that's not something that I can answer just without going away to look it up. Jan may be able to, because she's probably been to more flu meetings than I have, but I would not want to give that advice publicly without double checking.
No, Liz, sorry, I'm with you. I'd have to go away and check.
Yeah, no, that's fine. But if you could send something through to us and just update us, that would be really good. Thank you. And lastly, Councillor Sanford.
Yeah, I think one of the reasons that the concerns over the distribution of the flu vaccine are quite important is the fact that, you know, if we do eventually get a COVID vaccine, it's going to be absolutely imperative that goes out, that gets out to the people that need it as quickly as possible. So I think that's why that's important. The question I wanted to ask there was about 4.11 on local enhanced contact tracing, because, and I sort of asked the question at full council about this, and I only got a partial answer, I think. But because how things are operating at the moment is you've got like I think it's actually Serco that the government employs to carry out their track and trace, and the statistics I've heard is that they only manage to contact about 40% or 50%, and then it's handed over to the local councils, and we're told in the report that we've got a success rate of around about 80%. So, but I think my question is, how much of a hold up does that process actually cause? Because obviously with contacting people, it's really important that it happens as quickly as possible.
I think that's a really good question, Councillor Sanford. And what we're doing at the moment in Peterborough is, in a sense, it's effective but quite limited. In that the national test and trace call centres, the tier 2, which is health professionals, will try to contact the cases by telephone, and that's the first port of call. And in fact, they do succeed in contacting about 3/4 of cases and interviewing them effectively. So they do that quite quickly for quite a number of people. That the 20 to 25% that they don't manage to contact were coming through to us after 48 hours. That the process now is that they're expected to come through after 24 hours. And then we move ahead with contacting them through our local routes, which are successful in contacting many people who the national track and trace couldn't reach, or test and trace couldn't reach. So I think the issue recently is that there have been some delays, and some of that is delays in actually the tests coming through. So you're not just talking about the call centres. There's the test being taken, the time it takes for the test result to come through, then it goes to the call centre for the contacting of the case. Then they try for the 24 hours, and then that comes through to us. And sometimes there is a bit of delay on that, but that's the aim, to get through in 24 hours. Then we have our processes, obviously, and any time that it takes for us to contact them. So the ideal, which is for the test to be turned around in 24 hours and the contact tracing to be turned around in 24 hours, we're not always achieving, certainly. And our service locally is that fail-safe service. serious for those people that the national system hasn't contacted quickly enough. The 40 to 50% figure is not the cases themselves, but their close contacts and the success rate in contacting and interviewing and sort of completing the intervention with them. And again, that's lowest when it's just the call centre part of that. There is other contact tracing that actually Val, who is speaking, I think next, is involved in, where we contact workplaces or schools or care homes and do it in a setting. And that contact tracing in a setting gets a much higher success rate. But yeah, we're not achieving the ideal turnaround times on our test and trace, as I think has been well publicised. But we are still seeing good results in terms of who we managed to contact in Peterborough when it's handed down to us.
Okay, so that looks like it's all of the questions. So if there aren't any more, I'd like to note the recommendations in the report, which is for us to note and comment on the Managing COVID-19 Public Health Update. And has anybody got any objections for us to, with regards to this report? No. Okay, so that's fine. Thank you very much, Liz, for presenting that report. Thank you very much, Jan, for coming to our meeting. I wasn't expecting to see you today, so very nice to see you. It's always good to sort of get the insight on from CCG as well as sort of the public health side.
I think I'm here for the next one as well.
Oh, will you?
I think so. No, the next paper.
Or the next paper. Oh, right. Okay. No, well, that's fine. The more the merrier. But thank you for that report. So I will now move on to agenda item number 7, provision of healthcare for homeless rough sleepers during winter months and the impact of COVID. So I'd like to welcome the officers presenting this report: Val Thomas, Consultant in Public Health, and Merrick Zamborski, Head of Adult Mental Health, Learning Disability, Commissioning and Contracting. So welcome to you both. And who's going to be presenting?
If I give an overview of the papers, then I'm sure Marek and Jan will then obviously amplify it through the health service perspective elements of the paper. So if I set the scene and describe the overview of the paper.
Okay.
Okay. Well, the paper is a response to a request from the committee for information about the impacts of COVID upon the homeless population and how the positive responses that were made to that can be sustained going forwards. I think the paper makes the point that homelessness is very much associated with homelessness, and poor housing, that is very much associated with poor health. And I think the pandemic preempted action, which in a way which hasn't happened before, to look at the needs of the homeless in terms of housing, but also in terms of their health and well-being. The immediate response to the government request, it was a mandatory request to ensure that all those rough sleeping were housed immediately, did prompt a very quick response in Peterborough. I think within a week, 80 of those sleeping rough were housed, and then at the peak of the period in the middle of April, we had around 140 people housed through the initiative in Peterborough. And the other significant factor was how it really brought organisations together to work with those people managing the accommodation, with people housed within the accommodation, to look at how services could be delivered in a different way. And I think for me, the outstanding thing about this response was that I think I expected the worst for the homeless population in terms of the impact of the pandemic. And I was really expecting lots of cases, lots of spread, but in fact, it has not been experienced in any numbers, any large numbers whatsoever. And I think that is a credit to the immediate response and the efforts that services have made to manage the situation and to provide support and services to people in the hostels. and not just in terms of making it COVID safe, but also having an impact upon their health, broader health and well-being. I think probably the main areas in which which are concerning always with the homeless population is their mental health, their drug and alcohol misuse, but also they have a lot of general health conditions which need access to services. And that is what I think, which I think probably the opinion of people that have been working in over this period is that those health outcomes have improved over time. So for example, I can speak in terms of public health services, in terms of drug and alcohol services. The services went in, provided them in a different way. We increased our hepatitis C vaccination to levels we just hadn't anticipated. We've never been able to succeed doing that before by having that access to people. And also the immediate response of working with the hostels and making it as COVID safe as possible in terms of infection control measures, advice on isolation, self-isolation, and so on. And certainly going forwards, we've built on, particularly in the drug and alcohol services, on the model that's been developed. And now there was guidance out last Friday for hostels, which very much is focusing on going forward and the period in which we are going into now, which people have talked to throughout this meeting. And we're again working with the hostels, working with the services to see how we can best respond to this guidance, for example, around using of face masks and so on. And I think I'll hand over to my colleagues, Jan and Marek, now to talk about the health services response rather than me to describe them.
Yeah, thanks, Val. So obviously, one of the things that we're very conscious of through COVID is the inequalities are exacerbated, and that's why this work with the homeless is so important. And as part of the work that Marek is going to just talk through, I think there's been some good work done between organisations to go and speak to people and say, what is it that would work best to make sure that we can get the most information and the best signposting in place for those patients as possible. So Marek, did you just want to talk through the process that we followed for that, for those mental health services, talk about how we're going to improve things?
Yes, good evening, everyone. I guess huge credit to the providers of services, homeless services and services to rough sleepers. They very proactively lobbied on behalf of their service users, so much so that we eventually ended up holding a listening event with a number of providers across Cambridgeshire and Peterborough, representing the needs and voices of homeless people. Following that, I think I was able to identify within my team a commissioning time that took some of the recommendations, some of the ideas which we explored together forward. And out of that came response on 3 levels, which was shaped by the voices and needs of rough sleepers and homeless people, particularly housed in Peterborough provisions. So the first was more about explaining the already available services and access to those services, particularly when it comes to crisis management in mental health. You are familiar with our service 111 option 2, and there is a specific sub option in this service where the professionals themselves, rather than patients, can contact the mental health crisis line as well. So we made it very clear to the providers as well as the patients how they can utilize this service. In terms of the planned care or non-crisis care, we linked the providers with CPFT colleagues, and I think very pragmatically, in a safe way, we were able to work with CPFT and allocate some outreach capacity and outreach workers, mental health skilled workers, to be providing outreach activities in the provisions which were housing people through the first wave of pandemic. And finally, we made a bespoke investment from the CCG COVID fund after scoping what would really make a difference in addition to crisis and CPFT workforce for the first wave. And the area which we identified was actually very simple. And that was active, meaningful and proactive training to the providers to be able to support and provide almost a first aid and the mental health first aid need to their constituents and to their service users. So I think all of that interaction came reasonably, I would say, comprehensive package, which was able to address planned care, crisis mental health care, and also some specialist outreach to the housing provision for homeless people. I think that was around the mental health. There is something coincidental, which I think is going to make a huge difference going forward, even during winter, because it's becoming to be live as we speak. You've heard me talking about Peterborough Mental Health Exemplar last time. This is an investment which comes from the national government under long-term NHS long-term plan support for mental health services. We decided in our local conversations to the first tranche on investment in Peterborough. That means £2 million for mental health services in Peterborough. Within that investment, we were able to allocate 4 additional dual diagnosis workers employed by CPFT, supporting the cooperation between CPFT staff, mental health staff, and drug and alcohol services. As well mentioned in previous comments, the drug and alcohol services are vital and pertinent services for this population. And I think extra capacity is going to make a difference through the winter as well. So I think these are just few examples of what we are doing immediately. In order of sustainability of those services, I think there is a challenge for us together, and I will continue working with my commissioning team, with the providers of homeless services, to tap into national funding, which is coming online in next 3 years through the mental health programs. This is going to be a competitive funding process. And the result of that process will be 20 national sites having a bespoke investments for mental health services for rough sleepers. The first tranche had already been allocated, but we were not successful on the grounds that there are localities in the country that had bigger pressures than ourselves, and Luton was the location in east of England that got the allocation of funding for last year. But I think next 3 years, an additional £8 million across the country places us in a good position to be able to be in a competitive running for some of the portion of that money to have further enhanced investment into rough sleeping services in addition to what we have already discussed. And we are well prepared through the networking we've done through the COVID to be engaging in that process. So I think this is just a flavour of what mental health services are doing, particularly for a population of Peterborough. And I'll hand over back to Jan. She will probably speak a little bit more about primary care services or give you a flavour on primary care services for rough sleepers and homeless people in Peterborough.
Yeah, so just additionally, one of the other things that is currently happening, and this is at an early stage, and I believe somebody had some other information on the Lighthouse project. So we are in talks to them. So Gary, the chairman, and I have met with them and are looking at how we can support their work and their bids to make sure that we can do more signposting, so that we can get more access for people for primary and community care services. Because I think, as Marek said, the issue for healthcare services isn't that they're not available for this vulnerable group, just they don't know how to get into them. And we need to train people to get them support, to get them access into the right services. And if we can unlock that access for these vulnerable populations, then that will be the most successful thing. So they're the conversations we're having to try and take this forward. But we'll stop there and take questions.
Lovely, thanks, Jan. So, Councillor Bull first.
Thank you, Madam Chair. I'm pleased that Jan did recognise the Light Project Peterborough. They've done sterling work in respect of COVID-19. They were leading the swab pilot for people sleeping rough and those in supported or private rented accommodation. So that hasn't been referenced in your report, but obviously a big thumbs up to them for all the work they do. Very proactive, very on it, and they provide a plethora of services for the homeless in Peterborough, not least around mental health and physical health. In that regard, I'd just like to ask a specific question as regards 4.9, fourth paragraph. Have former guests of the Garden House, the Peterborough Light Project, been involved in this particular initiative, please? And I have a supplementary, not supplementary, I have a further question to ask after.
To be honest, I will be able to find exactly who has been involved or hasn't from my commissioning team, but myself took part, in addition to members of my team, in a listening event with a number of housing providers. Whether this particular organization was part, I will be able to find out and confirm in writing, so I wouldn't know at this stage.
Okay, it would be worth sort of contacting Stephen Pettigan, the Chief Executive Officer for the Light Project Peterborough. He's the font of all knowledge on homelessness in Peterborough, so that would be a good contact for you.
So just to be clear, so that's who Gary and I have had communications with and met with, is Stephen, and we are talking to him about what the services can look like and making sure that we are getting those access right. So that's what the work that Gary and I are doing. The commissioning team are trying to build really bespoke services, and we will make sure we make the right links on that one. I think
that's fabulous, brilliant. And can I ask, I don't know who would answer this question, it's my second question. What are the significant issues we're learning from being a central government homelessness prevention trailblazer?
I think the learning that has primarily come from the COVID situation is that it's something about the flexibility of services and being able to understand the needs of the homeless population and to ensure that staff have the knowledge and understanding of those needs to be able to flex. And I think I think the point that was made about how that Marek described of how they've involved a whole range of not just providers but also service users, and we've certainly used them in the public health services as well to inform us going forward. And I think it's that combination what the Trailblazers led to, that working closely with the services but working with housing services as well. And that which has been another benefit of the past 6 months is that I've never seen such close working between housing services and the whole range of services.
How are we actually faring in terms of the other Trailblazers?
I'm afraid I'm not in a position to answer that, Marek. I don't know.
I guess from the health perspective, so I'm not following the Trailblazer in terms of the investment in local government, but from the health perspective, what Val mentioned from my listening experience was the very clear and very positive challenge about the flexibility of health services to be able to facilitate the access. It's very easy for us to get registered with the GP and then based on that follow your normal path of accessing the service. If you are someone who is homeless and rough sleeping and your needs are intermittent, and as a health professional, if you are not in a right time, in a right place, then you might really miss the opportunity to provide the care. So I think it was one of the first big overwhelming messages coming out of that exercise. In order to support access to health services, the services have to be very flexible, working around that particular lifestyle of this population rather than the other way around. In terms of wider lessons learned from the national pilot for mental health investment in rough sleeping, through the East of England regional network of which I am part, meeting with other senior responsible officers, Luton will be presenting lessons learned, and we are closely observing and following their lessons learned about provision of the mental health services. And obviously, as we go forward, as I mentioned, and we are successful, we will be building on their lessons learned. So from that perspective, we are planked into regional and national learning.
Thank you, Marek. But I'm also conscious that the Light Project, the Garden House, have a dedicated doctor, Dr. Ruth. So there is integration and integral services working there. That is a highlight of probably why we were chosen as one of the government's homeless project trailblazers, because we are actually embedding. We're not only talking a good talk, we're actually walking our talk. So it's about whether we can get more funding into that to make it more robust. Ensure that we capture all these people that have substance misuse, mental health problems, housing issues. It isn't just one issue that the homeless people present. They have, they're multifaceted and multi-complex, and actually having those facilities on site, dealing with the fact that they're quite transigent, and that when they do come into something like the Garden House, that they are dealt with in an appropriate way. So that's a model which really works, and that the Light Project's been going for a number of years. It's a model which obviously, the Duke of Cambridge came earlier in the summer and looked at how well we're doing with our homeless people in this city.
I think you are rightly so highlighting this very positive piece of work. I fully agree with that. Actually, the colleagues you just mentioned were involved in pulling together from the mental health perspective the bid to draw on the first tranche of the mental health rough sleeping monies. Unfortunately, we were not successful, and the feedback which we received from the national team was based not on the quality of our submission, but on the prevalence of need, and they diverted the money to Luton rather than to Peterborough. So it was more of a political decision, but this is exactly a type of networks and stakeholders we are involving in order to be progressing our work from the mental health perspective as well. And I'm sure John is aware as well that our primary care colleagues are fully linked to the work you just described from the primary care perspective, and building on that through the bespoke conversation. So there is a really great baseline and foundation on which we are building, particularly for Peterborough, and I think places us in a really good position to be going forward.
Perfect. Thank you very much.
Could I just add to that?
Of course you can, Mel.
It was just, I think, talking about bringing money into Peterborough. It's referenced in the paper. I think Peterborough is one of 43 sites in the country that has been given the additional funding, and the bid that we put in is just under £500,000. I don't know how we'll get it, but I don't quite know. We should know, but should know shortly. But I think that is another example which is being fueled very much, and the way we could demonstrate in the application about how we are working across Peterborough with a range of organisations. So hopefully we will be successful in that.
Okay, thank you. So Councillor Ali next.
Thank you very much, Chair. I'm glad that the good work of the Lighthouse project has been mentioned. We're just a bit concerned that I know Marek said that the primary healthcare colleagues have been working very closely with them, but it would have been helpful to have mentioned that in the context of the report as well. But I think we said enough that it's very important to keep working with the Lighthouse project. But basically, I just want to really congratulate everyone how we as a city were able to get rough sleepers and homeless people into accommodation very quickly following COVID crisis. If we can do that so quickly, get rid of the rough sleepers and things like that, how are we not able to contain this situation, which was growing quite rapidly in Peterborough, to make sure that we actually, don't have homelessness and rough sleepers? I know it's a dream, it's a vision, but I think if we were able to do it so quickly, let's have us working together in the long term and make sure that we don't see as many rough sleepers and homeless people in our city. Thank you.
I guess I would want to second that, because one of the great learnings in this very difficult situation is what you just mentioned, Councillor Ali, that is, we were able almost overnight to pull together all sorts of resources and pragmatic solutions to deliver one of the fundamental shifts. And I think this is one of the probably following up the visions or dream statement, one of the big mysteries of what we are experiencing here in all sorts of health and social care services across, not just across rough sleepers. So I would, how and why, I think remains to learn from.
Okay, thank you for that. Okay, so there aren't any more questions. I've just got one for you. Obviously, we're going back into not a complete lockdown, but obviously things have changed this week with the government making a decision. With regards to our homeless, have you had to change anything, or have you literally been continuing what you put in place from the last lockdown? Just wondered whether there had been people back out on the street and you're having to find accommodation for them again.
My understanding that situation is being monitored very carefully, and the numbers did drop down. I think at the end of August it was just above 60, and there are 34 currently being housed in hotels in the city. And I think that's probably reflects the situation now and where we were back in March, April, where we didn't have those types of numbers, and the alternative solutions that have been looked at. And I think the additional Next Steps funding will really help with that in terms of the immediate response to the pandemic, but also to the ongoing development of initiatives to address homelessness, which is very much with us, and it has such an impact on health in the short term and in the longer term, and repercussions across families and so on.
Yeah, definitely. I mean, my concern is that we don't go back to allowing people out on our streets, that we do everything necessary, and who's to say that, you know, we might be in a bit of a lockdown for 4 weeks and then everything opens up again. But that's not to say that next year we won't end up in another lockdown if there's another spike. We really don't know, but certainly where our homeless people are concerned within Peterborough, I think we need to do everything possible to keep them in accommodation and not let them back out on the streets. So but I would like to give you all my thanks and the committee's thanks for everything that you've been doing. It's and the health connections that they need, because obviously, as we've already alluded to, they have complex health issues. So let's just hope that this actually is a good way of going forward for all of them. And we don't have any homeless. Hopefully. Just find my tab. So we don't have any more questions. In the report, we have that we note the recommendations and consider the content of the report. I think we've certainly done that. I can see that certainly this particular report will probably want to keep up to date with through next year. It's all right. I just saw a hand go up. That's fine. If are there any objections with regards to the content of this report from committee members? No. Okay. In which case, then report has been agreed by everybody. Thank you, Jan. Thank you, Val. Thank you, Marek, for attending. And if you wish to leave, you can do. Okay, so now on to item number 8, monitoring scrutiny recommendations. Paulina, I'll hand over to you for this bit.
Thank you, Chairman. This report brings to you a list of recommendations that has been made by the committee at previous meetings. They're listing outstanding recommendations which the committee have wanted to keep as an ongoing monitoring So some of them have been updated with actions that have been done since the last report that we had. So it's really for the committee to decide if they wish to take any further action on these recommendations or leave them as they are as an ongoing item for the next meeting and provide updates as and when we get them. Thank you.
Okay. Councillor Ball.
Thank you, Madam Chairman. On page 34, looking at the Best Start in Life strategy and children's public health services, can we, it looks as though it's without any local response. Would it be possible for us to send a reminder to the 2 local members of Parliament, because we were lobbying them for more grant funding for Peterborough? I know a letter was sent on the 18th of December, but we haven't heard anything for obvious reasons, I presume. But can a reminder be sent?
I don't know what Liz or Paulina, is that possible?
We certainly could raise it. I think one of because we have met with both MPs on this topic, so they are engaged in it and they understand the situation. I think one of the complications in a sense at the moment is that a lot of the funding is being directed towards COVID-19. So there have been a number of funding announcements about test and trace grant money coming in to support the public health response to COVID, and that is quite positive actually. There is national funding coming in, so I think that there's possibly something about the timing in that there appears to be success in getting funding into local authority public health to deal with COVID-19, and it might be. I'm just wondering about whether we should be engaging the MPs on the more general public health grant at this point, or whether we should be doing it when the attention is focused a bit more on other things. But I'm happy to, if the committee want me to write and raise it now, because it is a funding issue for Peterborough, and we know that funding for local government is very challenging at the moment. I'd be absolutely happy to write to the MPs and raise it with them again, almost in the context of Peterborough's overall funding.
I think it would be opportune, Dr. Robin, because we've got the Chancellor's November statement coming out shortly. So whilst we've got all of the COVID-19, the pandemic and everyone going into lockdown, I don't think we should miss the opportunity. He's actually going to be making his November statement. It would be good if our MPs just had pointy elbows and just nudged him in the direction, because we are seriously underfunded compared to the national awards.
Could I perhaps suggest that I take this away to just check with Pete Carpenter and Gillian and others how the national lobbying on our funding is going, because I think we would want to write if it was helpful in that lobbying, but possibly wouldn't want to be a distraction if there were other things that were being effective in that lobbying with the MPs. So could I could I suggest that perhaps the committee could recommend that I take that away and have that discussion rather than just making an absolute commitment at this point?
Eminently sensible.
Yeah, that's fine, Liz. No, not a problem at all. If you can just let us know as and when you have an answer, and send an email around to the committee with the decision that's been made. It's always something that we can review sort of in our January meeting anyway, so that's fine. Councillor Stanford.
Yeah, it's just on that point really. I forgot which meeting I got this from, but I understand that the most recent round of additional funding for local authorities on COVID, we've got about £5 million extra from that. But according to Peter Carpenter, we had a shortfall of about 12 million, so it leaves us significantly short. But I think the point that needs making to central government though is they when they give increased funding to councils, they always give it for particular purposes, and I think what's needed with public health grant is first to have a significant increase, so that then Peterborough and Cambridgeshire can choose how best that ought to be spent. Obviously COVID is a priority at the moment, but when the COVID situation sort of eases, there's a whole range of other public health issues that will need to be addressed.
No. Okay. So is that everything that you need, Paulina, with regards to an update for the monitoring report?
Yes, that's fine. Thank you, Chairman. I've made a note of the action. Thank you.
Lovely. Thank you. Okay, agenda item 9, forward plan of executive decisions. Does anybody wish to receive further information on any of the items? Please remember that you can only request information on items relating to this committee. Councillor Sanford, you got your hand up?
No, sorry, I've actually not taken it down from the previous occasion.
That's all right. That's fine. Just checking. Councillor Bull, have you got a question?
Yes, I've got a couple of questions, if I may. On page 58, item 22, why have we gone for a re-procurement on this one? Why are we asking for it to be procured again? This is the tender for the services of Dementia Resources Centre in Peterborough.
What page was it again?
Page 58, item 22. Why has that gone to procurement again? Does anyone know?
No, but there's let me see. Well, Paulina, is there any way that we can get Councillor Fitzgerald to give us an update, or Liz?
Yeah. Yes, sorry. If Liz is, yes, first I'd go to Liz. If Liz doesn't know, then I can certainly go to the officer and get a briefing note put together for you.
Yes, I think it would be better to go to the officer. This isn't something that's procured through the public health grant, so I don't have all the detail on that, I'm afraid, but we can get a briefing note out from the services involved.
Sorry, could I just check with June what the exact question was with regard to it?
Why did we have to go to procurement again on it? Was it the first procurement exercise failed? There was no one suitable to provide the service? Just really need to know a little bit more, devil in the detail about that one.
Yep, I've got that, thank you.
Yeah, and my second question relates to page 69 and page 75. Actually, on page 69, how does this mental health anti-stigma contract differ from that on page 75? Which is also about an anti-stigma mental health work.
Okay, and again, I'm assuming
I'll go to the officer and find out. Yeah.
Okay, so another briefing, an update on that one.
Thank you.
Good. Okay. Anybody else have anything? No. Okay.
I did just have one minor observation, if I may, Madam Chair.
Yeah.
On page 84, the very end part of page 84, where we're looking at the 12th of January 2021, should that not be, when we're looking at the work programme 2021, should it not be to consider the work programme for, not 2019-2020, we're not retrospectively looking at that, should it be 2021?
Yeah, you're right, it's just it hasn't been updated.
Thank you.
So that's fine. So yeah, we were just coming on to the work programme. And again, Paulina, I'll hand over to you.
Thank you, Chairman. Yes, so the work programme is brought to the committee as a standing item. It lists any items that you have requested for future meetings, and it's an opportunity to raise any items at this evening's meeting for consideration at the next group representatives meeting to add to the agenda if you wish to.
Okay, so Councillor Hemraj, first of all. Oh, you're on mute.
Can we add the East of England ambulance service, because they've gone into special measures now, so it'll be good to have a report back from them, or actually come to the scrutiny committee to see what they're actually doing, because there have been problems with them for the last few years. Nothing seems to be getting better. They keep coming in and out all the time.
Well, we've already had them this year, haven't we, Paulina?
Yes, we have actually, yes.
And in actual fact, I was quite pleased with the report because it was more comprehensive than we've had before. But if they have gone into special measures, what does everybody else think? Do you want to see another report from them? Right, okay, so
sorry, it's the fact that they've gone into special measures again. They were in special measures not, you know, back in the past, and I just don't think they seem to be learning from their mistakes.
Yeah, okay, okay. Well, we have the group reps meeting on Thursday, don't we, Paulina?
Yes.
So we can certainly mention it there and discuss it as part of the work programme then. So no, good to mention that. Councillor Sanford?
Yeah, just on that point that Councillor Hemraj has mentioned, I think that although, you know, it is good practice for us to set a work programme in advance, I do think it also needs to respond to things that happen. So in the same way we've just been talking about COVID, I think if there is significant issues with the actual ambulance service, and it looks as though that if they've gone into special measures, it looks as though there are. So I think we should at least look at the possibility of requiring a report on that. The other point I did want to make, though, is that we're going to find out at some point what decision the CCG has come to about the relocation of the sort of urgent care centre. And when we saw the preliminary results of the consultation, there was an indication that what people were saying was not necessarily supportive of what was been proposed. So I think I'm not saying we should put it on the work programme again, but I think we should keep open the flexibility that if they do decide to go against the consultation and that causes some sort of outcry, that we might need to talk about it again.
No, I quite agree, Nick. On Thursday, I was planning on raising that in the group rep meeting and seeing what they have to say, but I fully anticipated that we would have another report to update us on exactly what the decision was and why they've made the decision.
Sorry, Chair. Yeah, as I said in the recommendations report, we will be as soon. I think today was the day it was going to the board, and they have advised that they will provide us with a briefing note. So I expect that anytime soon in the next few days of what the outcome of the decision was.
That's fine. Okay. So are there any other questions? No. Okay. Good. Well, in which case then item 11 on the agenda, committee to note the dates of the next meeting. We have the joint scrutiny of the budget on the 11th of November, so next Wednesday. And the 12th of January is our next health scrutiny committee. So before we close, again, Liz, thank you for everything that you've been doing. We all really appreciate everything that you and the team around you do. It's not going away, and I would imagine by now you are feeling absolutely exhausted with everything that you've had to do. So look after yourself, don't overdo it, and yeah, we really do appreciate everything that you're doing, and take care.
I will feed that back to the team. Thank you very much, Councillor Aitken. They will be really pleased to hear that message.
Yeah, you know, it's certainly something that I think about on a regular basis. All the people that are having to work so hard, and especially as I'm going back into hospital on the 16th of November for some treatment. I've been extremely grateful for everything that sort of the medical services have done for me this year. So that's it, everybody. Thank you very much. It's been a good meeting, and I will see you all in January. Bye-bye.
Bye.